Hey everybody, my name's Brad Artery. I'm privileged to be the CEO of a healthcare software company called Mockingbird. Our mission at Mockingbird is to positively impact clinician burnout, and we do that by automating and simplifying ongoing education and credentialing requirements. I've been in healthcare as the CEO of Mockingbird for a bit over a year now, and I've observed a couple of characteristics that I find quite challenging and I think are challenging healthcare broadly. Number one is clinicians do not speak up. They accept it, whatever it is. It's often an additional requirement or burden, and ultimately clinician burnout is getting worse, not better. But number two, more broadly, I think the climate in healthcare does not focus enough on the providers or allow them to speak up. The focus is on the patient or the organization, rightly so, but additional attention needs to be placed on the provider. So, in my humble opinion, if I could ask for two calls to action, number one, clinicians and primarily physicians, speak up. You are the delivery mechanism for healthcare. Your voice is very loud. Your voice is very, very powerful. Ask change, ultimately demand change. But number two, and I rely on my leadership experience in the U.S. Navy a bit on this, one of the key traits of leadership is leading change in the face of resistance or adversity, knowing that there's a better outcome. If you find yourself to be the president or the CEO or the chief medical officer in these healthcare systems, then lead. Your providers need you to drive change and drive a positive impact on their well-being. I've observed too often the leaders I've worked with in healthcare are trying to protect their staff from change, and candidly, that's not getting the job done. Your providers need you to drive change and ultimately improve their well-being and positively impact clinician burnout. So I stand ready at Mockingbird, as does my team, to partner with you to drive this change forward. Let's go.